Good evening. This is Jenny Collier, and we're about to start our Value of the Ryan White Program campaign webinar tonight about how to communicate with policy leaders and media. I want to welcome you on behalf of the Ryan White Medical Providers Coalition and HIV Medicine Association. We're really pleased this evening to have Robin Strongen, Amplify Public Affairs founder, and a fantastic advisor who will train us tonight on how to best communicate with policy leaders as well as media about the importance of both the Ryan White program and HIV/AIDS issues in general. Before we get started, I just want to let folks also know that all phone lines will be muted tonight until we get to the questions section, during which we'll open it up for questions. But meanwhile, if a question does come to you, please feel free to use the webinar chat function to send us your question, or email your questions to info@hivma.org. Again, info@hivma.org. And just to kick us off, I want to provide also a little bit of context, please, on the next slide about the Congress and the administration and the idea of using messaging and media for the types of communication we're planning on doing. Basically, we've had a major election, and we're going into the new Congress and administration in early January. And as a lot of us have been hearing through the news and through our policy work, the HIV health program funding and Affordable Care Act issues are expected to be considered early on in the next Congress. And so doing this kind of work now to really think through the kind of messages we will need to use will be very critical to HIV education and advocacy success. So that's one of the reasons that we're having tonight's webinar. We also will be thinking, though, about how to better use media, including social media, which is going to be a very important tool for communicating with the new administration. Lots of media experience obviously went into this election cycle. We have a president-elect who's used Twitter in all kinds of ways that it's never been used before during a campaign. The press has been extremely involved in this campaign, more than average, not only professional press, but citizen press, who are on the ground using social media to get out both real and fake news sometimes. And so understanding the vehicles with which people are getting media information and providing media information is really important. And so tonight we wanted to include, as a part of our thinking about messages in this issue area, also some information about how to communicate these messages to both, as I said, policymakers and the media, because they are so important. And finally, I just want to say this is going to be a time when we really are going to want to engage more than ever before with the HIV medical provider community. We have had such great success working with many of you who are on tonight's webinar, as well as your friends and colleagues, new people who are on the webinar. We're excited to work with you to really use the experience of medical providers to kick off this education campaign that we want to do about the Ryan White program, because you all have wonderful firsthand experience and knowledge about how powerful this program is in terms of helping improve patient lives as well as elongate lives, and you have real experience on how the program works and supports people. So we really want to figure out how to work with you as much as possible in the coming year, and that's why we're really happy that Robin is with us tonight, because she has a lot of experience talking about health issues. And she is, again, the president and CEO of Amplify Public Affairs, which is a woman-owned and small business. And she also created and founded an award-winning blog called Disruptive Women in Healthcare, which I know many of you will be interested in reading. And she's had 30 years of experience working on communications issues as well as inside and outside of government. And I think her specific policy experience on healthcare issues specifically, as well as her communications experience from so many different perspectives, will really help us understand how we can move forward with our best foot forward in communicating about the Ryan White program. So Robin, welcome, and thank you so much for joining us this evening.
Thank you very much. It's a pleasure to be able to be here for the webinar tonight. I think that the timing is perfect for this topic. I mean, last week we acknowledged World AIDS Day, and I had the chance to review some of the blogs on the Science Speaks blog, and it was really fascinating. We were talking before the webinar kicked off about the way that the media covered the epidemic in the early days, and just all of how things have changed, how the science has changed, and how really advocacy has changed with AIDS. And so we had World AIDS Day last week. We have, as Jenny was talking about, a new Congress and a new administration that's coming into town. So now more than ever, our work is cut out for us. And the only other thing I want to mention before I hop into the slides, and Cheryl, you can go to the next slide in the meantime, is that along with the slide deck, there was a sheet of some talking points that was shared with you. We are not going to spend a lot of time on that document, but rather focus on the slides for this evening. And those are messages that will continue to be massaged and used as the year unfolds, but it's a good resource for you to have as we go through the slides. So I just want to kick it off by saying that, of course, Ryan White, the American teenager from Kokomo, Indiana, became a national poster child for HIV/AIDS after he failed to be readmitted to his school following his AIDS diagnosis. And obviously, there were many others who became the face of this epidemic. But it's really Ryan's legacy that remains today, with the better quality HIV care and longer life for those living with HIV/AIDS, due largely in part to the success of the Ryan White program. And so we're going to kick things off by not only paying homage to some of the many people who had the courage to advocate and communicate for people living with HIV/AIDS, but to talk about the best way to communicate about this. And as we go to the next slide, you'll see that really fundamental to communicating is the message. We have to have a message. What is it about what you want to convey that somebody should really care about? And for a message to be effective, it needs to be a combination of personal stories, compelling stories, and data. And there is enormous power in storytelling. You just have to look at Humans of New York as one simple example of human interest stories that have really taken off. And if you're not familiar with Humans of New York, I would urge you to take a look online at some of the extraordinary work that's come out of that. In the next slide, you'll see a couple of oldies but goodies. These are not specific to HIV, but they are examples of what I think are extremely effective messages. And although long-form, thoughtful analysis in journalism still does indeed exist, the ability to really rise above the noise and to break through and be heard, to have something memorable, and to be able to make it in plain English so that non-medical professionals can understand what you're talking about is critical. You have to break through this. We talked about Twitter, Jenny did, and obviously that is how people are communicating today. So some of these messages, I'm sure most of you are familiar with them. Atul Gawande's Health Services Research Will Save More Lives Over the Next Decade Than Bench Science was really remarkable. He spoke to Academy Health at one of their annual meetings several years back now, which is the Professional Society for Health Services Researchers. And what made this memorable was typically when you're advocating and lobbying, NIH has a very strong lobby, and they talk about the lives saved that their research is doing, which indeed it does save lives. But Atul took that notion and sort of, turned it on its head and talked about health services research and the value that brings. And this was done in the context of trying to educate legislators to save the Agency for Healthcare Quality and Research, or AHRQ. Similarly, the Institute of Medicine report and the Robert Wood Johnson campaign both had very, very powerful messages that they used. The RWJ, when you're uninsured, life turns out differently, was one of the foundational messages that went into the work of the Affordable Care Act. So as you can see on the next slide, what I did here was pull together some specific HIV/AIDS messages that are more recent. They're not just U.S.-based. So HIV, it's different now when you become we. And what I think is really powerful about this is the video that was done to go along with this campaign, the Vancouver Stop Project. And we're not going to look at the whole video, but you have it in the deck. So if you have time later on and are interested, we'll play about a minute or so. And I would ask you to take a look as you're watching how it opens in black and white and eventually turns to color. And you can see the arc of the story, and I think it's very well done, and so just want to play a little bit about it to give you a flavor of the powerful use of images and stories and history encapsulated into this particular campaign. So Cheryl, if you could play just about a minute and 20 seconds of this. Uh-oh.
Robin, for some reason it's launching here, but it's not unfortunately launching for participants.
Oh, okay.
It's not.
All right. Well,
So
in that case, if it doesn't, yes, I don't see it. So what I would suggest is when you have a moment to take a look at it yourself, if you want, and as I said, I think it's quite well done. Before we, if we could go back to that slide for just a moment, some of the other points that I did want to make is that some of the other messages that I think resonate really well, I saw circulating on Facebook on World AIDS Day. And Dr. Karen Hine, who posted about a book that she co-authored several years ago, the title was Trading Fears for Facts. And I thought that that was an excellent example and very compelling. Similarly, CDC has Start Talking, Stop HIV. And then going back in time a little bit, well, way back to when when AIDS first began, there was the use of symbols as messages. So many of you may remember the use of the pink triangle that ACT UP used in the late 80s. Silence equals death. There were documentaries made. And these are all tools that are being used to carry messages. So symbols, the use of video, very short but compelling use of word choice can really resonate, whether it's with a lawmaker, a key influential that you're trying to talk to move the conversation forward, and of course with the media. So now if we can go to the next page, there are a couple of tips that we like to share with folks when you are getting ready to speak with decision makers. And I just want to spend a little bit of time on audience because obviously audience, that's key. And media in and of themselves are not always the end audience. We use the media to actually reach other audiences and decision makers. And we do that through a news story, which is called earned media. You send out a press release, a reporter's interested in writing about a new report, a new study, or you have a relationship with somebody in the media with whom you want to talk about whatever the issue is. There's also the opinion pages, of course, the op-ed pages where you can write opinion and bolster it with fact. And then there's the use of advertising, which, whether it's online advertising or print in the paper, can be extremely effective ways of communicating and sharing your message. We've done work where something has happened in the field, a clinical trial may have done very well or not done well, and we want to make sure, or a client wants to make sure, or somebody wants to make sure that word gets out to the right audience, whether it's academic health centers who are conducting other clinical trials, whether it's Wall Street, whether it's a legislator in a particular district. You can reach them knowing what they read every day through any one of these means, even if it's taking out an ad for one person who you know will be reading the Wall Street Journal. You want to carry the message to different audiences. That does not mean that you change the message. It simply means that you know where and how your audience is getting information and their facts. And your goal is really to be the point of connection for that audience. So, for example, if you are speaking to a legislator, visualize that legislator's voter. And that's the way you want to frame your conversation and your message. If you're speaking with a journalist, you want to make sure to ask questions and to get to the point. You want to use your message over and over so that it is what the takeaway is from that conversation. And of course, you want to make sure that you are using terminology that is clear and understandable. It may be that you are using jargon or you are using a word that means different things to different people. So you want to make sure that you are clear, that you define the words, you can do it in a way that is not condescending. Congressman Pete Stark, when he was chairing the Health Subcommittee for Ways and Means, he used to do a lot of public speaking and would talk about how he ended up with health because there was tax and he didn't think that was going to be a big deal, so he took this little health committee, and he said by the end of the week, he was joking, that every single advocate and lobbyist in D.C. had come to him about different organs and body parts, and he didn't even know he had so many, and he became an expert very quickly. As I mentioned with avoiding jargon, that gets you into deep trouble very quickly. And just be truthful. If you don't know something, it's perfectly fine to say, I don't have the answer, I'll follow up, I'll send you information, and do that. Your goal is to become a reliable, trusted source. So when that journalist or that legislator or that influential needs information or has a question, you are the first person that the individual will come to for that information. It is really important. Every either health clinic or health system or academic center does have PR and media people in-house, all of whom have a process, and they have different policies for speaking with the media. They also have their own relationships. And so it's very important when you do engage in conversations with the media, and similarly in these organizations, they will also, if they don't in-house, they will belong to professional societies and trade associations who, in addition to communication arms, will have government relations and advocacy arms, also with relationships that they can tap into for you. They're a great resource, and they would urge you to please inform them so that they can share with you their policy, you could share with them conversations, you guys make sure that you are you representing yourself as an individual physician? Are you speaking on behalf of a health system? Are you speaking on behalf of a professional society? It's really critical for all of those organizations to be clear about what the rules of the road are and on which behalf are you speaking. So with the next slide, we'll go a little bit more into the use of other ways to communicate some of the messages that you're trying to get across. Again, you want to make it understandable. If you've done some research, not everybody will care about or knows about regression analyses. You want to make them relevant to that audience with whom you are communicating. One example that was particularly well done was several years back, the March of Dimes wanted to make an impact on the importance of prenatal care. Employees who are pregnant and they wanted to make the case to employers why it was important to offer, and this again was many years ago, so this was not necessarily the case across the board, but how important it was that pregnant women who are still working were not penalized in any way for time off to do prenatal visits and wellness and so on and so forth. So the March of Dimes contracted with a very reputable consulting firm who did a lot of quantitative work, and they crunched the numbers that would be relevant to employers, small, large, and in between. And they did a terrific analysis of the value of prenatal care for employers on productivity, on return on investment, and so on and so forth. So the March of Dimes employed good messaging, great data, used a trusted, reliable, well-respected firm in town to do the data crunching, and then had a campaign to reach out. But they understood what was important to that audience, and it's a great example of using messaging, the proof points to back it up, knowing the audience, and presenting the facts in a way that were meaningful and were able to achieve the goal. And they were quite successful. Using anecdotes and personal stories, obviously HIPAA compliant and so on, are extremely important. People more and more and more want to be able to see and visualize what's being talked about. Speaking in pictures is helpful. You remember we talked about symbols and pink triangles. Those are memorable. On the next slide, you'll see something that's a little bit of a lighter note. So Dr. Uwe Reinhardt is a health economist at Princeton and very involved with health services research and benefits. And he actually had several kids, I think one, if not both of whom are physicians now. But back when they were much younger and Uwe was talking about different benefits, the economy of benefits in kind, he had, I think it was his daughter, drew direct benefits, which you see on the left, which are cash and vouchers, and then he had her draw indirect benefits. And as you can see, he is married to a Chinese woman, so the kids were speaking Chinese, and I'll let you define what that word in the middle is there. I'll leave that to your imagination. But in any event, using graphics to depict transfers in kind benefits. So that was just one example. On the next slide, research can get very bogged down, as I said, in lots of statistical analysis and so on and so forth, and you really want to be thinking about, to engage with people initially, the headline and the takeaway. It doesn't mean that there won't be an opportunity to go and get into the details, but you need to start with the headline, so you think Twitter, and then go into the context setting and the depth of the data. Should the audience be interested and have issues? Obviously, if you're speaking with other clinicians, that's a different story. If you're speaking with people who are trained in statistics and understand all of this and that's their language, no problem there. But if you're speaking to a member of Congress or somebody in the media who really wants to understand the framing, give them what they want and give it to them in simple, easy-to-use chunks of information. What you see here in the yellow box is an infographic, and I cheated a little bit because it isn't hardcore research per se, but you could take the headline from a peer-reviewed journal article with some data and convert it into something that really lets you know what you've done. In this case, this was MTV, and they have their Staying Alive program, which is used to fight HIV globally. And they use the dollars that they raise to fund innovative youth-led programs across the world. And you can see here they've reached over 500 million young people. They've distributed over 7 million condoms, and they've tested 185,000 young people. So really impressive. This was since 2005. And it's a really nice way of showing and showcasing the results of the work they did. And the reason this is important is numbers really matter, both on the Hill and at the state level as well, and with the media. Being able to paint a picture of comparisons, use of numbers. Oftentimes, folks in education advocacy will say, how many bake sales do we need to get to where, we could afford a fighter pilot when they're comparing their budget to the Defense Department budget. So being able to paint a picture and use data are very, very successful and effective tools. You'll see on the next slide, as an example, in chronic care, this was not in the most recent election day, but in a couple past, I think it was probably about 8 years ago now, there was a new coalition on chronic care and starting to really look at the whole issue of chronic care. And you can see it was the Partnership to Fight Chronic Disease, how they used different information to make the point and use them as messages. So between the Iowa caucus and Election Day, more than 1 million Americans will die from chronic disease. Between the New Hampshire primary and Election Day, chronic disease will cost over $1 trillion, and then 75 cents of every dollar spent on chronic disease, and that cost is growing. They actually ended up in a lot of they meaning the topic of chronic care. They were very successful in their messaging and in their strategy to get to the different campaigns. They ended up, there were questions in several of the presidential debates that didn't just deal with healthcare, but dealt with the issue of chronic care. And they really did a terrific job in getting, really working on the messaging, refining the messaging, and getting to the right people to be heard, and the awareness spread. In the next slide, you will see, again, the use of a tool that's a visual. This is a build slide. It is taking data and using a good use of visuals. This is from the award-winning National Awareness and Anti-Stigma campaign called Let's Stop HIV Together. And this is from the American Institute for Research, or AIR. And I use it as an example of what I think is a good example of some visuals that are easily understood and have important information and capture your imagination. And the numbers in this area, as you all know, are staggering. So there's many, many, many messages, stories, and information that needs to be shared. Let's see, let's go to the next slide. And again, I mentioned that the power of the press is really to drive public opinion, drive and foster awareness, education, and ultimately it's a way of communicating with the different audiences, which we've already identified and you see listed here. I do want to mention that a really important audience are those who disagree with you. And certainly, as there is in any aspect or any topic or subject matter, there is a range of people who disagree with you. On the outer fringes, left and right, there will be a percentage of individuals and organizations that no matter what your data and who your messenger may be, you are never going to move that needle. It just is what it is. But for the vast amount of people and organizations and societies, really the 80%, there is a lot of opportunity to educate, sway, change minds, and progress forward. And that's where a lot of the energy needs to be spent. And again, I cannot stress how important it is that everybody has a story or knows somebody who does. And I'll go back to what I said earlier. Your goal is not just the message, but it's how you connect with the people with whom you are communicating so that you can accomplish whatever the goal and the issue is, whether it's the Ryan White program specifically, whether it's access for care for folks who can't afford it, whatever the issue is, the message needs to tie back, and there needs to be a context and a goal so that there's an understanding of it's not just enough to do X, but you want to accomplish Y as well. So let's move along to the next slide. And here again, just to reiterate, it's the media, and I will stop and say for a moment that it's pretty clear and a colossal understatement to say that today's media is going through just an enormous transformation, whether and where people are accessing their news, whether it's fake or real or myths or disinformation. We're going to put that aside because that's a whole separate webinar for another day. But media still exists. There are very credible journalists. There are terrific outlets that still serve the public well and really are at a pivotal moment in time. And it's actually an opportunity for all of you who are trying to reach out to them to be able to communicate the importance of the work that you're doing, the programs that you're advocating for, and the patients that you're working with day to day. Somebody needs to be telling their story. And if it's not them individually, the patients, then you may be the person that is the conduit to the media, the legislator, or whomever. And you want to make sure that the facts and your side of the story, your patient's story, are framing that broader issue. You're providing the facts and the figures to support the notion of what kind of change is necessary. And again, the relationship building between you and reporters, between you and your members of Congress and so forth, is really remarkably powerful. And the first time you have something to share shouldn't be the first time that you're talking to the reporter. Being able to nurture that relationship is critical. And again, the folks in your facilities and clinics and so on could be very helpful in fostering those relationships. Let's go to the next slide if we could. So there's Sam Donaldson. And he reminds us that it isn't so much the questions that you are being asked that causes trouble, it's how you answer. And so, again, these communication channels through the media are critical, and the more comfortable that you are in speaking with the media, the better. It can be very nerve-wracking to talk with the media for a number of reasons. People have seen hatchet jobs in the press. Reporters use tactics like asking open-ended questions and then not speaking. So there's lots of awkward silence, and most people don't like awkward silence. They want to fill up that airtime. So while you're speaking with a reporter, it is possible that he or she will deliberately just remain quiet, and you, in a nervous moment, will just keep talking, talking, talking. You need to be very conscious of that and just answer the question, just provide the messages that are important to you, and just provide the facts and the figures and the context of what you want. So just be aware that that is one particular tactic that can be used. There are some tips for dealing with difficult questions, as we'll see on the next slide. And remember, reporters have deadlines. They have pressures like everybody else, but they also hold a lot of sway and a lot of power in that they literally can move markets and affect legislation and are a conduit for education to all kinds of important individuals. Diffusing these difficult questions, you want to be able to deliver your positive message. You don't repeat the negative. Don't be drawn into a what-if hypothetical scenario. If a reporter starts with a what if, you can bridge. We call it bridge. It's a tool. It's a tactic. back to your message. So you can literally say, look, that is a hypothetical situation. I can't speak to that, but what I can say or what I can tell you or share with you is blah, 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 and you go into your message. You want to be very careful of leading questions where, again, you want to be honest. If somebody is trying to bait you into something that you know is a loaded question, simply call them out. Nope, that's not true. Let me put it in this perspective. Here's the important point. If somebody is not providing a named source, meaning a reporter, or unsubstantiated charges, you can, again, know your ground. I don't know who you're quoting. I don't know what that site is, but I can tell you, according to my data from my source, which is X, Y, and Z, here's what I know to be true. And if somebody starts firing away multi-part questions, answer the part you want to answer. Answer the part where you have the facts and you want to make your point. And again, no matter what anybody else is doing, my advice is always be honest. If you don't know something, no shame in it. Just say, you know what, I don't have that answer. I will look it up and get back to you. And then very important, you want to get back to that reporter quickly, particularly if he or she is on deadline. I also would like to say a word about conversations being, quote, off the record, and some may disagree with me here. I always go into a conversation with the assumption that nothing, and I mean nothing, is off the record. I will tell you there are times when reporters, if you have a trusted relationship, a long-time relationship, will come to you for information on background. That is a case-by-case basis. It's a relationship-by-relationship basis, and that's really a call you're going to have to make. But initially, while you're starting to feel out and develop these relationships with people, I always assume something's going to end up in print or online, always. Eventually, as you get to have those long-term relationships, you can start to ease back a little bit, but my recommendation is nothing is truly off the record, and that's just safety first in all my years of experience. So moving along for the next slide, how to get the word out. I'm not going to read all of these to you other than to say there are a number of communication channels through the press, but also around the press, that are really very effective. We've talked a lot about press, whether they're press releases and so on, opinion. Polling is a really interesting use of information that media and the Hill are very interested in looking at what people understand, what people think, how people make comparisons, and polls. You know, again, you need to put a context around it, but what is important to the American people? Where should taxpayer dollars be invested and funded? Should it go to population health, to public health, to research, etc.? Very, very powerful to be able to come out with information on polls. Being creative is another way to get your points across. There, of course, are letters to the editor and op-ed. There's also op-art, again, infographics, using pictures to tell a story like Uwe did with his children. You could say a lot with horses and so on. Of course, there are TV and radio shows, but there's also, in today's world, multimedia, digital, social media. Podcasts are a huge deal right now. Lots and lots of creative potential. Earlier on the webinar, Jenny was mentioning the use of Twitter in ways that heretofore we really haven't seen, and I suspect we may have a State of the Union done over Twitter. Who knows? So we shall see. But this is a very powerful very cost-effective, I would tell you, way to go in terms of reaching a lot of people and a lot of populations and demographics are using social media, and it's good to know who's using what, for what purpose, and then being able to dissect how you reach your target audience using the different tools, using your message, but using these different communication channels most effectively. Media really do rely on Twitter. They follow stories, they see who's saying what, and it's a great place to communicate with media, and with members of Congress also are using and becoming quite good with the use of social media, whether it's Facebook, Twitter, Instagram, what have you. I will also just mention, as a matter of course, just as PR and media folks within institutions and government relationship have policies and procedures, so too on social media. You do want to make sure when you are tweeting and so forth, whose name are you doing it under, what is your organization or clinic's rules of the road for this, for compliance, and so on and so forth. For many, many, many years in the healthcare space, blog was a four-letter word, at least as far as the legal departments of hospitals and life science companies were concerned. A lot of that has changed, obviously, but there are still important processes that would be good for you to be aware of before you go, diving into this pool. Let's see if we can go to the next slide. I do want to say that while Twitter's great, really want to give a fair amount of time to peer-reviewed journals and articles, decision memos, issue briefs, white papers. These are heftier, but there is definitely a place and a role for substantial information. Certainly an executive summary doesn't hurt. And one thing I will tell you is on every single piece of paper, whether it's online or hard copy, assume it will get separated, so have your name and phone number on each and every page just as a header or footer, because someone's going to separate the executive summary from something else, and you want to make sure no matter who has what document, somebody can reach you if they want to follow up. So don't forget about these particular types of communication vehicles. They're really important as well. And then finally, and I don't know if this is going to work because it's another video, but on the next slide, I do want to say that in addition to the message, the messenger also matters. So I'm not telling anybody on the phone something that they don't know, which is that young people listen to young people. They get their information online. This young person has over 4 million followers. He is talking about all kinds of information on World AIDS Day and is actually on there for almost 7 minutes and does, gives a lot of good information. But another legendary messenger and advocate, Elizabeth Taylor, said it is bad enough that people are dying of AIDS, but no one should die of ignorance. And I would say that that's where all of you come in. And as you'll see on the wrap-up slide, I will just end where we started, which is to say that the Ryan White program, which on your message document, which we are not going to get into today, right at the top says is a life-saving public health success. So my final question really back to all of you is, why is the Ryan White program so important today, particularly in the environment that we find ourselves in with a lot of uncertainty? And whose story are all of you communicating? Is it yours as a medical professional caring for maybe vulnerable individuals, patients? Are you speaking on behalf of the public health, population health, all of the above? And one thing I would urge you to think about and literally start to do is between now and the next webinar is to start collecting stories and data and start thinking about how you would frame those messages and who is it that you want to speak to educate and influence, to move whatever needle with Ryan White program forward. That's important. So with that, Jenny, I'll turn it back to you and see if maybe there are any questions. And I'm sorry you didn't get to see the videos. If you do have a couple of minutes, I think they're probably worth your time. I thought they were very well done. So.
Hi, and this is Andrea Weddle with the HIV Medicine Association. We're just going to unmute the lines. We're in the process of that. We did not receive any questions via the chat or questions. Whoops, let's see. Actually, now we have one that just came in. Let me just pull that up. Let's see. Oh, actually, it was more of a comment, so thank you for your comment on the webinar. But let's see, so I believe the lines are now unmuted. I will open it up. It's a fairly small group to see if there are any questions anyone would like to ask Robin. Okay, well, I'm not hearing any. Also, feel free to submit them online. We do want to make sure we welcome your feedback on the session, and we will follow up with direct links to the videos so everyone can check them out. Really want to thank Robin Strongen with Amplify Public Affairs and Jenny Collier with the Collier Collective, and she also convenes HIV/AIDS's Ryan White Medical Providers Coalition. And really encourage you to participate in the second webinar. And also feel free to send us your questions, comments, or other thoughts via email.
Hi, this is Marwan Haddad. Can you hear me?
Yes, we can. Thank you.
Oh, excellent. Hi. So, you know, I know that there's been a lot of talk about Twitter and, you know, thinking about how to reach out to the media. Like, for instance, at my agency, we do have a big communications department that we're starting to work with. So, of course, I can always work with them in terms of trying to set things up. But I'm thinking, you know, everybody's talking about Twitter. And, you know, I don't have a Twitter account. I never really done the Twitter. Should that be something that I should start looking into as a means of communicating? And how do you start doing that? So that's a question out there. Like, should I start?
So this is Robin, and I think that's an excellent question. My advice to you would be go to that group first, your communications group, and ask what they have already underway and how, if you're interested in going, this is the point I was making about what are their rules, can you speak on behalf of the organization, are there any specific rules? But if you're looking to establish yourself as an expert, typically most organizations will encourage you to do that. They would just ask that you keep them apprised. There are usually some social media policies that you just need to take a look at and make sure you're familiar with. But that is a very good way to reach out and connect with reporters. And what you might want to do is start to just look at some different Twitter feeds and follow some major reporters that you're aware of or people that you typically would follow in the newspaper and see what it looks like on Twitter. But there's no reason not to set up an account, but I would urge you to just check in with your communications team so you are following their requirements.
That's great. Thank you.
Sure.
Looks like we did have a question about whether we are coordinating a coordinated campaign, and we are just about to launch, and this webinar series is about that, and I'm sorry, I think Jenny Collier's who actually runs our Ryan White Coalition, is having trouble connecting back in. But we are about to launch a campaign that we're calling the Value of the Ryan White Program campaign, and as part of that, we're going to have some videos, and we're going to develop more fact sheets and actually incorporate some of the suggestions from Robin today on infographics and making it a little more accessible, some of the messaging and information. But we also will be providing support to providers who are interested in participating in that, and that's one reason we're holding these webinars as a two-part series to first really focus on sort of how we can fine-tune our messaging and communicate more effectively. And then the second one, which Jenny Collier will lead, will provide tips on actually doing policy education and how to go about that, and the different opportunities and ways to do that depending on your capacity. So we welcome anyone who's interested in continuing with us to work with us on that. Please let me know. You can either email me, and I'm going to follow up again with everyone who registered, again with the webinar links. And then we have recorded the webinar so that you can listen to it again or share it with colleagues you think might be interested. But you can either email me, and my information is on the last slide, or our general HIVMA email box. We think, especially right now, it'll be really important for the medical provider community to be engaged on Ryan White issues and also just more broadly on healthcare access issues. So we were glad we had a good turnout tonight. Are there?
This is Marwan Haddad again. Just to follow up on that question, are we looking as a group eventually for sort of a general message on certain sort of 3 or 4 messages that we want to get to federally, and then looking at more local sort of issues that may be happening in terms of just a direction of where we want to go and what message we want to give? I guess that's just sort of maybe wait and see until what you I guess, or us as a group are going to sort of come up with general sort of goals of messaging, I guess, and what we need to do. We might not. I'm assuming we might want to wait until the new administration comes on for us to figure out what exactly our messages need to be, which may be different than what our current sort of administration's messages would be. But just a few things.
That's a really good point. And so I apologize if you didn't receive it. If anyone didn't receive the sort of 2-pager that I shared a couple hours before the webinar by email, again, please email either me or Jenny, and our contact information is on the slide in the presentation. That was our starting place. Again, those need to be fine-tuned and, take into account some of the good information we received from Robin. The other thing is the HIV/AIDS Bureau has been putting out more and more data on Ryan White programs and their effectiveness and how and really patient outcomes. And we're expecting a new client-level data report to come out with 2015 data anytime, sometime in December. So we'll be looking at that as well to pull out key data points that we can use. And we absolutely welcome feedback from the providers on the messaging. Our main message now has really been that the Ryan White, our thinking as we were first developing this, and it's evolving, but was to really promote Ryan White as a critical public health program and a successful, a highly successful one. Are there any other questions or comments? Either on the information from the webinar or more generally on our new campaign? Well, again, really want to thank everyone for joining. We know you all are busy. We do hope you'll join us for the second webinar, and really want to thank Jenny Collier and Robin Strongen. It was terrific information, and we can all put to good use. So thanks again, and please send us your feedback, comments, or other questions that may come up. And have a good night.